Stop scrolling for a second, because what I'm about to show you looks very small but is now causing students to fail Nclex. And the crazy part is, most people don't even realize they're doing it wrong. I'm talking about something you probably ignore every day: patient dignity and privacy. And yes, Nclex is now testing this heavily. Here's why this is dangerous. You'll see a question, and all the answers look correct. But only one answer truly protects the patient, and that's the one Nclex wants. This is not just about being nice. This is about professional nursing care, patient rights, safety, and respect. And if you miss it, you lose easy points. Dignity means treating the patient with respect, protecting their self-worth, and making them feel valued. Examples: covering the patient, speaking respectfully, and asking before touching. Simple, but tested. Privacy means protecting personal space and protecting patient information. Examples: closing curtains, knocking before entering, and not discussing patients publicly. Nclex loves this. Let's test you real quick. A nurse is about to perform a procedure. What's the best action? A. Perform quickly. B. Explain and close curtain. C. Ignore discomfort. D. Call another nurse. Pause. What's your answer? Correct answer: B. Explain and close curtain, because it protects dignity and privacy. That's Nclex thinking. A nurse discusses a patient loudly in the hallway. Is that okay? No. That violates privacy. Even if the info is correct, how you say it matters. For my international nursing students, this is where Nclex is strict, because expectations may differ. But here, patient dignity is non-negotiable. You must adjust your thinking to pass. Use this rule: exposes patient wrong, protects patient right. Easy way to win points. Be honest. Have you ever ignored something like this before, thinking it doesn't matter? Comment below. If you're preparing for Nclex 2026, especially as an international nursing student, you need updated strategies like this. Pass your next exam using RN and LVN Refresher online help from Gab-Nic Excelsior Nursing Tutoring Center. Go to my profile, tap the link in my bio, and select RN Refresher. Inside, you'll get case-based learning and updated Nclex breakdowns. And don't forget, check my YouTube for full lessons. Let me ask you something. Have you ever completed a nursing question? Evaluation is defined as determining whether patient goals and outcomes were achieved. Like once you choose an action, you move on immediately? This is the final step in the nursing process. Evaluation. Yes, evaluation. During evaluation, you must always ask, did the patient improve? Were goals met? But important note, it is not the end of thinking. It is a continuous cycle. Were goals partially met or not met at all? And what do we do next? Because Nclex is not just asking what happened, it's asking what you do next. There are 3 possible outcomes. 1, goal met. Continue or discontinue the plan. It asks, did it work? 2, goal partially met, revise your interventions. And 3, goal not met, reassess the patient and start the process again. This is where students lose marks, because they stop too early. Let's apply it. Patient has shortness of breath. SpO2 is 88%. You intervene, give oxygen and position the patient upright. Later, SpO2 becomes 96%. What does that mean? Evaluation, goal met. But Nclex may twist this and ask what comes next. Let's zoom out. The nursing process is cyclic, dynamic, and patient-centered. It is evidence-based and requires critical thinking in overlapping steps. It never truly stops, it keeps going. Most students struggle because they skip assessment or confuse diagnosis types. They misprioritize interventions or forget evaluation entirely. And Nclex loves testing this gap. Here's the mindset shift you need. Nursing is not step-by-step memorization. It is a cycle of thinking. Ask yourself, did it work? If not, why? What next? That is real nursing judgment. For my international students, this step is often underemphasized. But Nclex expects you to evaluate outcomes, adjust care plans, and think critically. Not just perform tasks, but think. This entire nursing process forms clinical judgment and guides safe care. It prevents errors, improves patient outcomes, and is heavily tested on Nclex. Be honest, have you ever stopped at implementation and forgot evaluation? Comment below. If you want to master the nursing process, you need structured learning. Pass your next exam using RN and LVN Refresher online help from Gab-Nic Excelsior Nursing Tutoring Center. Go to my profile, tap the link in my bio, and choose your refresher course. Inside, you'll get full breakdown lessons, case studies, and Nclex style practice. And don't forget to check my description on YouTube for full lectures. Let's get to work.
Profile. Once you're in, select the RN Refresher course. You'll also find a weekly timetable to help you study consistently and stay on track, so you don't feel overwhelmed while studying. Revisit important topics. It's not just about studying harder. So if you're ready to improve your understanding and stay consistent,